Hi guys and welcome to Amygdala's Bane. Today we'll be talking about depression. So we'll be talking about the different types, the symptoms, the causes, and the treatments. Yes.
There we go.
There we go. That's the episode.
Okay, so depression is basically defined as having a consistent period of low mood, which goes on for a while. So most of you will know about major depressive disorder. I'll get into the types in detail later, but the symptoms for major depressive disorder are basically you have like loss of interest in activities that you once used to enjoy. You have a consistent like low mood. You feel tired or exhausted. You might have experience changes in your sleeping pattern. Like either you get too less sleep in the form of insomnia or you oversleep. There's also feeling restless and agitated or feeling irritable because you're in a low mood or just because maybe you got less sleep. There are consistent feelings of like feeling guilty and hopeless because an important factor in your negative emotions is your negative self-talk that comes with depression. And it's mostly just you shaming yourself, or it's you feeling guilty for things that you don't necessarily need to feel guilty for, or just like generally just having a negative tendency to have a negative outlook. And because of all this, there's also trouble concentrating or making decisions because you're so occupied. You become so occupied with the low-level mood that you have trouble like making a decision, like you second-guess everything that you're doing, or you have trouble concentrating on schoolwork or something. And depression can also contribute to a certain level of memory loss. So it might be harder for you to revise things, or you may experience short-term memory loss. And of course, there's also thoughts of death or thoughts of suicide, so a preoccupation maybe with thinking about how you're going to die, or a preoccupation with how you can die. And usually for major depressive disorder, these symptoms will go on for like 2 weeks or longer, but for each of the different types, the duration and the severity of the symptoms will be different, which I will go into later after Kazi covers the causes.
So one of the main causes of depression and one of the factors that increase your likelihood of getting depression by a very large magnitude is abuse or bullying. So any kind of abuse that will raise your chances of getting depression by a very high degree. There is also a genetic basis for depression. It's not with any mental health disorder. The genetic basis for any mental health disorder is not very well understood, and it's a very complex chain of events that are involved in the process. But we have seen the likelihood of depression in some families being higher. So if you have a history of depression in your family, it's likely that you will also it's more likely that you'll suffer from the disorder. One of the other reasons for depression is just on a biological side, it's been linked to a smaller hippocampus. So we're not really sure how that affects your depression, but maybe it's hormonal differences, or maybe it's not enough serotonin in your brain that's being produced, but it has been linked to depression, a smaller hippocampus. One of the other reasons for depression is hormonal changes or having a hormonal disorder. So when going through puberty, it's sometimes common to go through depression or go through a phase where you're sad, where you're very extremely sad for a very prolonged amount of time. And that's due to hormonal changes. It also could be due to hormonal imbalances. It could be due to, and those hormonal imbalances could be due to the food you eat, or because your food is so highly processed. It could be because you're eating those kinds of things. Another cause for depression is going through a major event, so something like death or a loss in the family, or having some kind of other personal problem. That also can be a leading cause for depression. It's interesting when we talk about loss or something major going on, because it's actually healthy to go through a sad period then. When we distinguish it from a healthy loss as opposed to depression, it's the magnitude, it's how long you face those symptoms. So it's the breadth of those symptoms. So it's normal to be depressed after you go through something major like that. It's normal to be in a very, very sad state, and it's actually abnormal if you don't go through that state. Sometimes illnesses can cause depression too. This might be because of the illness itself, so it might be an illness that's affecting your brain chemistry, or it might be that the illness itself is so debilitating that that is causing you depression. So, two examples here, it could either be a disease which is affecting your brain. So, let's say you're having like seizures or something similar which is going on in your brain. So, it might be that in your brain chemistry itself there's something wrong, so you can't really feel happy anymore. Let's say you have cancer or another very serious disorder, in where just the treatment and staying in the hospital all day, those things in themselves are causing you depression. Another thing which causes depression is substance abuse. Almost 30% of people with substance abuse problems have major or clinical depression. This is because the drugs and alcohol, they temporarily induce happiness. And the problem with drugs and alcohol is, and why drugs and alcohol, you can get addicted to them so easily, is because you need a higher amount of drugs and alcohol to feel happy. So what you're doing is you're artificially creating serotonin in your brain. So what that does is that your brain is like always creating, like your brain's neurotransmitters, they're always making serotonin, and then the receptors on your neurons, they're always filled with serotonin. So what that does is that your brain gets accustomed to it. So you need more and more every time you're trying to feel happy. So what you're doing is you're destroying your own brain chemistry. It's because you're going to start needing more and more, and that's how it's even with antidepressants. Sometimes if you're taking too many, your brain gets used to them. So this is with any kind of medication really, related to the brain. You have to take more and more to feel the same effect, because your brain's receptors start getting used to it. And what happens is that some of the times the stimulants or the neurostimulants, they get stuck in the receptors, so your brain needs to make more effort to feel what your brain is trying to tell you.
Yeah, exactly. So moving on to the types, everyone has heard of the term depression before, and I'm sure most of you were aware of the symptoms before I discussed them in the podcast today. But what people aren't usually aware of are the different types of depression. So the most commonly known would be major depressive disorder, which has the symptoms that I talked about, like loss of interest or weight loss or weight gain, trouble sleeping or feeling sleepy all day, feeling guilty, and having trouble concentrating and stuff. So how the different types work is that it's generally these same symptoms, but it depends on their severity and their duration. So when they occur during the year or for how long. So for major depressive disorder, these symptoms need to have been going on for almost every day for 2 weeks or longer. And it has to involve a depressed mood or loss of interest in activities. And then you have the persistent depressive disorder, which includes chronic major depression and dysthymia, I think is how it was pronounced. Both of those come under persistent depressive disorder. So the difference between these two is that it has the same symptoms as major depressive disorder, but for a longer period of time, and they're slightly less severe. So it will go on for about 2 years or longer. And and people with this disorder can also experience some periods of major depression, which is sometimes referred to as double depression. Then we have manic depression, which is also bipolar disorder, which we discussed in one of our previous episodes, because bipolar disorder involves both ends of the emotion spectrum, like two extremes of the emotion spectrum. So you have manic symptoms, which are usually high energy symptoms, which include feeling euphoric or feeling irritable and angry and a lot of high energy. And then they also have the depressive moods. So those depressive periods are known as manic depression. For more detail, you can refer to our previous episode. Okay. Then we have seasonal affective disorder. How that works is the depressive period will usually occur during the winter season, when there's less light and the days are shorter. And occasionally, there is a rare form of seasonal affective disorder that is known as summer depression, which will occur in the spring or early summer period.
No.
What do you
Summer
mean?
depression
Yeah.
in summer?
Yeah, that's how it works. I don't know why. It's insane, but that's how it works. But yeah, that's more rare, but that also occurs. Then there is the even lesser known psychotic depression. Now, in this one, it's basically all the symptoms of depression, which come along with psychotic symptoms. So, like, psychotic symptoms would include hallucinations, delusions, paranoia. Basically, like this falls under the psychotic disorders like schizophrenia or something, which have a lack of attachment to reality. So hallucinations are basically hallucinations are related to the senses, the five senses, and it'll be like you have auditory hallucinations, which will be hearing things that aren't actually happening, or there will be visual hallucinations, which will be maybe seeing an old lady sitting on the couch that isn't actually there. And then delusions are not sensory, they are based on your false beliefs. So having the delusion, for example, that maybe you're being hunted down by a secret agency or something like that. And people with this with these delusions and with these kinds of disorders genuinely believe that their hallucinations and their delusions and their paranoia are real. They're as real to them as the sky is blue. So, yeah, and people who have this disorder, on top of their depressive symptoms, they may also feel like they might appear angry for no reason. They might neglect their appearance because these are symptoms that are common with individuals who have a psychotic disorder. There's also something called situational depression, but this isn't technically a term in psychiatry. Your psychiatrist could refer to this as stress response syndrome, but it's also sometimes called situational depression because it's basically when you experience the depressive period or the depressive mood after a stressful event in your life, so like a death in your family maybe, or a divorce, or losing your job, and of course, it is healthy to feel the full spectrum of emotions, as Kazi has emphasized in this episode and previous episodes. And it's healthy to grieve, and it's healthy to feel sad when something bad happens or when you're in a stressful situation, rather than being happy all the time. But it gets to a point where it's unhealthy. Like if it takes too long, or maybe your depressive mood has caused you to harm yourself, and things like that. So in that case, it would there are high chances of it being stress response syndrome or situational depression. You also have atypical depression, in which the instead of having maybe weight loss or maybe weight gain, it's more the symptoms will be increased appetite. It'll be sleeping more than usual. There will be a heaviness in your arms and legs. There will generally be a tendency to be oversensitive to criticism, like being a bit less receptive of criticism or rejection, and maybe reacting in a slightly exaggerated way, which can result in a lot of problems in relationships. And there's like this kind of almost paralyzed feeling, or feeling of your body just feeling like really heavy and laid down. Then we have premenstrual dimorphic disorder and postpartum depression. So these occur in individuals when due to hormonal changes during pregnancy or during menstruation, which may lead to chemical imbalances which affect the mood. So in premenstrual dimorphic disorder, besides feeling in a depressed state, you might experience mood swings, irritability, anxiety, trouble concentrating, fatigue, change in appetite or sleep habits, and a feeling of being overwhelmed, both in the emotional sense and in the sensory sense. And this usually occurs when an individual experiences these symptoms at the start of their period. And then you have postpartum depression, which is basically experiencing major depression in the weeks and months after childbirth. So usually it begins within 4 weeks after delivery, and it's linked to, it's chemical as well as psychological. because of the pressure of having a child. It depends on the social situation of the individual, which can factor into already the change in the hormones that are occurring at that time. So, for example, after like maybe someone's in a situation where they're in an abusive household, or someone's in a situation where it might be financially difficult for them to have a child. So multiple factors can go into having PPD. But there's a lot of stigma around this because mothers or fathers are expected to be happy as soon as they have a child. So usually, according to the statistics would actually be a lot higher if everyone who experienced these actually came forth and discussed it, because there's a lot of stigma, especially in our society, related to these things, and it's also difficult to identify because it involves difficulty sleeping and appetite changes and frequent mood changes, but these are also just sometimes confused with natural changes that occur after pregnancy. So it might be difficult to pinpoint, but at some point the symptoms get severe enough that help needs to be sought out, and the person needs to be checked if they might have PPD.
For the treatments of depression, with any kind of mental health disorder, it's important to know that we're not really 100% sure of how the medication and treatments work either way. So whatever treatment you're getting, you have to be certain that that type of treatment works for you. You should go through so there are basic guidelines that any psychologist or psychiatrist will suggest, and then you work with your psychologist and psychiatrist and you find what works best for you. Some antidepressants don't work for everyone, and some antidepressants, which are really, really rare, have really, really good effects on someone. This is for all mental health problems. Some things just work for some people and some things just don't work for some people. And even if something does work for someone, the side effects could cause that person to not take it no matter what. So if an antidepressant is working but it causes a lot of weight gain, someone with body dysmorphia may not want to take the medicine anymore. So you need to get something that meets all the criteria for someone to take the medicine regularly, if you even need medicine, and if psychotherapy is not enough for you, which sometimes it could be enough for you, but it's okay if it's not enough. If you're not feeling any better, it's okay to go for medicine and stuff like that. So first kind of treatment, you have to go to therapy. With therapy is usually a good thing to go to even if you're taking meds. I would say that the therapy, I would say more important, but I'd say for any mental health disorder, it's imperative that you go to therapy. Even if you're taking the medicines, you should take therapy. You should either take therapy first, where a psychologist can say that you either need medicine, or while you're taking medicine, you should go to therapy as well, to talk about how the medicine is affecting your mental health and basically what you're feeling, what led to those feelings, how long those feelings have been going on. So therapy is important. There are many, many, many kinds of therapy. There are a bit too many therapies. There are many different types of therapies, and it can be really confusing to know which type of therapies you need. The most common type of therapy, obviously, is cognitive behavioral therapy. That's just normal talking therapy, but there's so many types. There's no end to them. Some people say that physiotherapy helps. There could be light therapy. You have water therapy. You have exercise therapy. You have any kind of therapy that you can think of. My suggestion with this is that you go with the person who is the most qualified. You don't want to go to Dr. Bob, who specializes in water treadmills, who's an engineer. That's not really a psychologist. You want to go to the person who has the most experience. So if you're a licensed cognitive behavioral therapist in Europe or in America, that means you at least have a PhD in it, and then you have training years. So that means that person has at least 10 years of experience to learn to give you therapy. So you need to know what kind of therapy you're going for and what the prerequisites of that therapy are. So be a little bit aware of what you're going to and be cognizant of what those things entail, and just be smart about it. So check what the therapy is before you go. Usually the ticket item is cognitive behavioral therapy. That's what most people go to, and the laws surrounding cognitive behavioral therapy are also the most sound. So it's the safest to go to because it's regulated by the government and stuff, and then they make sure that people have the proper requirements and the proper training to be able to do that. And then for second thing, we have medicine. So we have the psychiatric side of it. For medicine, of course, in the name, you have antidepressants. But again, as I was saying, antidepressants don't work for everyone, and they might have side effects that don't work for you. And again, some antidepressants that may work perfectly for someone else may not work for you. With any kind of medicines, when you're talking about mental health disorders, it takes a very, very long time to be able to get accustomed to that. One, because you need to go through so many different kinds of medicine. So you have trial periods. So how it works with medicine and psychiatry is that you have trial periods with reduced doses of medicines, and then slowly you work towards higher doses of medicines based on the effect that those smaller doses have. And this not only takes a lot of time, but it's also expensive. And you need to make sure whether you're living in a place that has free healthcare for mental health resources, or whether you're living in America or somewhere like that where you need the insurance, or where somewhere in Pakistan where I'm pretty sure insurance does not cover mental health costs. It might cover psychiatric costs, but I'm pretty sure it's not going to cover your psychological help. So you need to be aware of what your insurance covers and what you can afford. Psychiatrically, I think your insurance will cover it, but you're going to have to talk to your insurance provider, of course, from where you are and what your country situation is, because you might have free healthcare as well. So with medicines, you have different types of medicines going on. Basically, what those medicines are trying to do is it's trying to emulate what your brain is normally trying to do. So the purpose of antidepressants is to kind of kickstart your brain to start like producing it normally. It's like a car where you like kind of like push the car to like start the gas. It's like you're trying to kickstart the brain into producing it normally. The point of antidepressants aren't to take them to completely replace the brain's function. That would not be healthy, and you'd need at that point it would be a drug. You'd need more and more every time. The point of antidepressants is to basically kickstart your brain into working properly, and that could take years and years. And some people don't go off of antidepressants ever. So you need to talk to your psychiatrist about what that entails and what that looks like. With any kind of medicine, especially if you have niche kinds of depression, or you need antipsychotic medicines, in places like Pakistan, those things aren't really regulated. So I'm pretty sure even if they are like, it's banned to like get them like off the counter, I'm pretty sure there are many places you don't need a prescription, you can just get them off the counter. So my point here is that don't self-diagnose. Mm-hmm. Be sure that the medicine that you're getting, you have a prescription for it. It's been given to you by your doctor. Don't go to my point here is don't go to, if you're feeling like really upset, don't go to the pharmacy and get like 40 Xanax. Like it's not advisable. You should go to a psychiatrist first, get that prescription, be sure that it's not interfering with something else. You might have an underlying problem that might react very terribly with the antidepressant. So please talk to your general physician or your psychiatrist first before you do anything like that. And then, of course, you have normal coping mechanisms, and you have healthy coping mechanisms that psychologists are going to suggest to you if you are suffering with depression. What's important with depression is that you have a healthy support system around you, and I know some people don't have that for them. But if you do, it's important to take advantage of the support system that you have. Talk to someone about what you're feeling. Talk to your friends. Talk to your family. Someone you can trust. Someone you can confide in. The second thing is that you start losing a lot of interest in things. So you start losing interest in things that you would previously be very, very interested in. So just try and get yourself involved in something. Volunteer. Get a job. Do some community service work. Just do something that gets you occupied. Do something that is fulfilling and that gets you out of the bed. Basically, you need something that's going to distract you, and you need something that's not going to keep you confined to your room all day. So yeah, you just need to talk to people who care about you. You need to keep yourself busy. Go somewhere. Go for like dinner or something with someone you know. Just keep yourself busy and talk to people. That's the most important thing. Of course, with depression, it depends on your likes and dislikes too. Like, what do you like? What did you previously enjoy? And maybe if you go with someone else, maybe you can enjoy that again. If you're going with someone who you care about, maybe not alone, but maybe if you have someone with you, and you do something like going to a movie, maybe that can bring you some joy temporarily. Also, things are generalized sometimes. So, let me give my example is that. Um, so let's say I'm not. Let's say someone's not a fan of heights or something, and the advice is that, well, you should go rock climbing and like look at nature through a giant hillside. That might not be helpful for everyone because you're scared of heights or something, or maybe it's because let's say you're very sensitive to the sun or something, or you can't go outside, or you don't like going outside. No matter what the thing is, you need to know what you like and what you dislike, and then take the advice of the psychologist, talk to your psychologist, and then based on what your needs are, you do that. So that could mean maybe some people, a lot of places tell you to read books and read stuff like that. Maybe you never enjoyed reading books. There are a lot of people who don't like reading books. Maybe you could substitute that with watching a funny movie or a TV show or something like that. So it really depends on what you need. And that's basically what we're talking about when we're talking about coping. With coping, the thing with coping is that you'll find your own strategy, and you need to be able to find your own strategy, and you could discuss that with your psychologist, maybe writing something down, keeping yourself busy, talking to people. But ultimately it's about you figuring out what you need and you figuring out what works best for you.
Yeah, exactly. But even with trying to figure out what works best for you, you might be limited by, such as if you're not financially independent, and because of the stigma associated with mental health disorders in general, and on top of that, depression, you might not be able to see a psychologist or a psychiatrist or a mental health professional. And in those cases, there are other options online. There are apps that help for free. So there's an app called 7 Cups, in which basically you can you can be anonymous and you can talk to a listener. They will basically have some sort of there is a training thing in the beginning of the app for people who register as listeners. So they have to take a mental health course. So they're not like per se qualified individuals, but they do take a course, so they do get the gist of what they're doing. And basically their purpose is to hear you out if you have certain concerns and stuff, and you can't see a psychologist or psychiatrist, so you can talk to them. They might be able to give you advice. They can give you a kind of support system in case you're lacking one. It'll just ease the burden of keeping it inside, so that you don't have to bottle it up. You can actually get it out somewhere on a safe platform, and where you can get advice that you might need.
Again, that platform might not be that safe, so
be careful.
I mean, they're like random people.
Yeah, exactly.
I mean, most of the because I know people who use 7 Cups, and like I've seen 7 Cups too, and like I've seen videos on it. It is just random people like signing up, but most of them are like they're signing up to give therapy for free
exactly.
of their time. So most of them are really nice people, but maybe if you're talking about like if you're talking about controversial topics or something, or you bring up something that's not like universally accepted, so then be careful.
Yeah. Well, the be careful thing goes with everything, whether you're seeing a mental health professional or if you're using an app like 7 Cups. You should always be careful. Because, like, controversial topics, especially in our country, you need to be extra cautious of what you say. There's also, other than 7 Cups, there's also this other website called Bliss Depression Therapy. And I think they had an option for chat as well, but basically their main thing is they have this kind of 8 sessions of self-help. So there's like these 8 sessions that have there are some exercises to do. There are some like prompts to basically help you identify your own thoughts and your own feelings, and do certain exercises that are meant to help boost your mood or help you figure out maybe the underlying cause of your depression. So you can also check those out whichever one works better for you if you don't have the option of seeing a mental health professional.
Just generally, there's like a million apps.
Yeah.
Wait, let me find an app. I remember an app. Yeah. So you generally have lots of different apps. You have a Calm Harm, which is a self-harm app. So it's giving you substitutes if you're self-harming. So it's basically just breathing exercises and different exercises like that. It's a really popular app. It's a really popular app, and I've seen a couple of videos on it, and I've seen some psychologists recommend it as well.
In addition to the like part of the stigma is also not only that people tend to avoid the topic of mental health problems and, like, in this case, depression, but it's also factors into people not taking it seriously. So a person who has depression or is depressed might be seen as lazy by their parents or by their family members, and that's not the case. That's not what it is. It's not the person choosing to be sad all the time and the person choosing to not work or not be able to concentrate. It's because of their low mood that they can't perform the same way as they would if they weren't in that state. It affects your memory. It's been proven through research that it affects the hippocampus size, and that's responsible for how your memory works. And if that's smaller in a person with depression, that means that they will have problem memorizing things. So if a person with depression is getting low grades and their parents take it as laziness, that's not true. It's just that they actually they're not able to perform optimally, basically. And that's a misunderstanding. If you think that you have depression, you are not lazy. You need to get the proper treatment. There is a reason for feeling the way you feel, and you need to get the proper help. It's not you being lazy.
One other misunderstanding is the difference between being sad and depression.
Yeah.
So the difference here is that the magnitude of sadness and depression is much greater.
Yeah.
And also it's about magnitude as well, but the main difference between both things is the amount of time for which you are sad. So depression is categorized as a prolonged amount of time for which you are feeling really sad. Sadness can be a very, very extreme, but if it wears off, it can't be categorized as depression.
Mm-hmm.
Again, I mention this every episode, but again, sometimes feeling sad is normal. Feeling sad is healthy. Feeling sad is okay. If you have a loss and feeling upset, it's okay to be sad, and it's okay to be sad for a pretty long time as well.
Mm-hmm.
So sometimes it's okay to be sad as well. It's not okay to be depressed. It's okay to be sad, and there's a difference between those two things. It's okay to be sad sometimes, but it's not okay to be depressed. It's okay to be happy for prolonged. It's okay to be happy, but it's not okay to have a. It's not okay if you're having a manic episode.
Mm-hmm.
Not that there's anything. I'm not trying to say that you're not okay or there's something wrong with you. I'm trying to say that it's unhealthy. It's not good for you. It's not going to be good for you. So it's the same category. Happiness is okay. It's good for you. But hypermanic or manic disorders where those thoughts are pervasive, like they are in depression, that's not healthy for you. It's the same kind of thing you're working with.
Yeah, and we weren't, Kazi and I were not comfortable with discussing self-harm and suicide in detail in this episode. So we will be providing links to videos and apps as well if we find them in the description box thingy, YouTube. So you guys can check those out for details on that.
Well, guys, thanks for tuning in for those 8 weeks. I think me and Gule I think going through those things, especially because we're going to study psychology, learning the kind of perspectives, going through the research, going through the resources in Pakistan, looking at it through the lens of a conservative country, I think it was an eye-opening experience for me and Gule as well, and I think me and Gule will look at our experience making this podcast fondly in the future.
Yeah.
Unfortunately, we both have to start uni now, and So this is gonna be our last episode.
Yeah, and I hope that, and yeah, it was a really fun experience. And yeah, as Kazi said, eye-opening. And I hope that it was also the same for you guys, for the few of you that listen. I hope that you guys got interested in understanding mental health problems, and we hope that the resources that we also discussed helped you guys. We hope that you guys will continue researching mental health disorders and trying to help the mental health community, and just to help raise off the stigma in this country. And yeah, just like be kinder to each other and take care of yourselves. And yeah, that's
just generally. Thanks for supporting us.
Thank you so much.
So
it means a lot to us.
bye, guys.
Bye.